Hi there, I'm Diane Goodmanson, and after almost 3 decades in healthcare, there is some truths that keep coming up. And one of them is that people that lead in healthcare cannot create change when they are only allowed to act like a robot, when they're treated like a robot, because we must have space to be able to think and to feel and to lead and to listen, right? Otherwise, the whole system cannot function properly, especially when it comes to patient care. And this may sound like a really strong position, but it's absolutely real. And this is one of the reasons why I'm here today. And some of you know a little bit of my story. I grew up super quiet and I was so quiet. I didn't say anything. I stayed small. I stayed safe. I didn't want to make waves. And those patterns followed me through my professional life and even into leadership. And I was one of those people that worked super hard. I carried the weight for others and I said, yes, I can do it over and over, which then, that is more and more weight saying, yes, you can do things, right? And then 2020 hit. And at that point, I was carrying a huge patient load in a private service, and I lost my other nurse practitioners, so I was carrying their loads as well. And I had lost my admin staff, and so I was trying to care and trying to keep people safe and trying to hold everything together. And it just wasn't working. I could feel myself disappearing and diminishing because it wasn't because I didn't love the work, because there was no room left to be in leadership energy, because you must have the room to think. You must have the room to vision. You must have room to breathe, right? To think about how can I make things more positive and how can I improve the service and what can I do differently, or how can I help others in a more inspiring way, and taking that time to listen, to learn what it is you can do to make things better. So this is really a big deal. Having that space is a really big deal. And just yesterday, I spoke to a retired healthcare leader who said something that just hit me right in the chest. And it was almost like a confirmation of what I already knew to be true. She said that managers in healthcare today have no say anymore, no space for vision, no power to make things better. We're just expected to do tasks like robots. And she's right. When leaders are boxed into endless to-do lists with no voice and no even capacity to have influence, then guess what happens? Performance on the team drops. Teams collapse because they also start to feel like robots. Patients feel the disconnect of being cared for by robots. So people do not join healthcare to operate inside a little tiny box. They join because they want to help. They want to strengthen their communities. They want to make things better. And so when the system takes away a leader's ability to lead, well, everything downstream suffers, right? And that realization, that loss of voice, that loss of clarity, that loss of space is a huge part of why I wrote the book, Rooted to Rise. So when I talk about rising, I'm not talking about climbing the ladder or being inspirational. I'm talking about coming back to yourself, coming back to your authentic voice, and coming back to the leader that you were before the system drained you, right? And rooted is part of who you are authentically, like your values, your instincts, your humanity. And to rise is simply what happens naturally when you lead from that place, right? You are able to be grounded, clear, and connected. So it's not about effort, pushing, forcing. No, it's about alignment, right? So if you're watching this video, my guess is you probably feel this as well. You care a lot. You carry so much more than people see, and kind of tired of the robotic, task-driven culture that really silences good people and pushes out the ones who actually have a vision to make things better. And I've seen it over and over. I totally get it. And I've lived it. And that's why I'm sharing my work more openly now, because healthcare is not going to necessarily change from the top down, right? Transformation comes from the roots. Culture starts to change from the top, and it will change from those leaders who actually start to become their authentic self, who reclaim their authentic voice, who lead from an understanding of psychological safety. Really? So what that means is that they pause, listen, and are truly genuine, without judgment. And leaders who know that real performance, bringing the best out of people, starts with human connection, not treating people like robots. And so Rooted to Rise is where I've been documenting the heartbeat of everything I've learned, not like steps, but as a way back to leadership, especially in healthcare, that feels true, meaningful, and alive, because that's the kind of energy that patients want as well. So as a leader, if you're feeling stretched really thin, if you're feeling unseen, or if you feel like you've been pushed into a little box with no room to think or dream to make how to make things better, or to even lead the way you know you need to lead, then I want you to know something. You're not the problem, because the system has evolved to this kind of place. The system is problematic, and you deserve to have that space to step back into real leadership, to have that clarity, and to have your voice matter, because that's how you are going to have that fulfillment. And that's how your staff are going to have fulfillment, and they're going to be able to give 110%. And then your patients will also feel the effects of the frontline providers giving 110%, which is exceptional. And this is what we want, right? I mean, I am also a patient. You're also a patient. I'm also a leader, and I can share the concerns other leaders have, right? So you deserve that space. So remember, this is why I'm here, and this is the work I'm committed to, and I'm really happy that you're here with me sharing on this journey.